this skill here is the bedpan skill. So I'll wash my hands. Knock, knock. Good morning. My name is Xavier. I'll be your CNA for today. Is it okay if I check your name bag? Meredith Gray. I'll be calling you Mrs. Gray. Nice to meet you. So I'll be helping you with your bedpan. Is that okay? So I'll grab my supplies. I'll be right back. So I'll wash my hands, grab my supplies. So I'm going to grab the Chux first. And then I'll wash my hands to grab the rest of the supplies. Alright, so I'm going to go ahead and raise the bed to a comfortable position. I'll lower the side rail. And I'm going to ask, Mrs. Gray, can you please cross your arms and cross your right leg over left leg? I'm going to turn you to the side, so I'm going to put a Chux underneath you. 1, 2, 3. So they turn, and then I'll put the Chux underneath. We're also going to put the bedpan as well. So with the bedpan, we want to make sure to put some powder. So place some powder on the rim so the patient doesn't stick to the bedpan. And then you want to make sure that you put the bedpan in the correct position. So it's going to be this way. Just remember the taller part is going to face the patient. So we're going to place this here on the patient. On the count of 3, we're going to lay back down. 1, 2, 3. And I would have my first set of gloves for this one. So the patient's on the bedpan. I'm going to make sure to raise the side rail for safety. And we're going to lower the bed. So here's your call light. You have your toilet paper here as well. And I'll be right back. So if you need anything, press the call light or I'll be back in 5 minutes. So I'll wash my hands. The curtains are already closed and then they're going to call. So ring, ring. So I'm back. So you're finished? So I'm going to go ahead and adjust the bed. So I'll adjust the bed back up. And then also when I put her on the bedpan, make sure that the head is up as well, for Fowler's position. So when I'm back, go ahead and raise the bed and then lower the head of the bed. So we're going to lower the side rail. I'll put on my second set of gloves. And I have my water, it's 105. I have them test it, it's fine. And then I'm going to have them turn. So if you can please cross your arms and cross your right leg over left leg. On the count of 3, we're going to turn. 1, 2, 3. So please hold on to the side rail. And as they're holding the side rail, make sure you hold on to the bedpan because you don't want that one to get spilling all over the bed. Let's put this in a bedpan cover, and we're going to put this in a chair. So grab another Chux, and this Chux here will be on the chair. We're going to clean the patient, so I have a piece of tissue. Make sure to wipe upwards, so I wipe upwards once. This goes into the garbage. And then I'm going to grab a hand mitt, get some water, soap. We're going to clean upwards, going 1, 2. So water, soap, 1, 2, and then rinse again upwards, 1, 2. I'm going to go ahead and pat dry. So I do have another towel that I have here, and I'm going to just pat dry the back side. This Chux will go into the garbage. Let's lay back down, 1, 2, 3. We'll remove the gloves. I'm going to wash my hands and I'm going to raise the side rail. We'll lower the bed for safety. And I'm going to go ahead and grab my next set of gloves to clean up the supplies. And actually with one of the other washcloths, we can clean the patient's hands. So we should do that first before we do the bedpan. So I'll take the bedpan. We're going to go ahead and take it to the bathroom. Check for any abnormalities, anything that looks unusual. This one will go into the garbage and this will go into the toilet. We're going to dump it, rinse and dry, and this goes into their personal belongings. So from here, these gloves come off, these go in the garbage, and I have my last set of gloves to clean up. So all of these will go into their personal belongings. These go into the hamper. and trash. Was there anything else that you needed? Alright, so here's your call light, your phone, tissue, water, and magazines. If there's anything else you need, just let me know and I'll be right back. So I'll open the curtains, I'll wash my hands, step outside, record, and report.